So my first topic is, the question today, the topic for today is women and health challenges. Let's just go about the definition of health challenges before we dive into the other discussion.
Okay, so I want us to understand that to start, health is something that when there's no deviation from your normal physical, mental, social lifestyle, when everything is going well. So apparently when you have a challenge, it's something is not right somewhere. It doesn't even have to be physical, it doesn't have to be something you see. Just something somewhere is not right. It just be a little feeling of only they are a little tired. So the things as basic as that should be looked into. Now I understand that there are things that are peculiar with all human beings. There are things that are just peculiar to just women. These are things that only women can feel or they can actually go through. And they're the only ones that have to put attention to make sure that you prevent those things. And I'd like to give an example of things like that. To go in sequence, I'd like to start from the fact that from when women are born as a girl child, they have to go through a lot of challenges. Considering the fact that there are some social cultural factors that used to happen before that when you give out a female child, people are a little disappointed, they want a male child, but that cannot be considered as a health issue. But when you have a girl child in that situation, is when you have a female child and there are some good practices that are put in place, like cutting the child's clitoris, what they call female genital mutilation, to prevent the child from going into menstruation, which is not even an ideal reason, and not something that would happen. These are things that could cause death in babies because when you say that part, sometimes you infect it and a lot of things can go wrong. And growing up, they have to do that at every stage of their life. You understand? So growing up, I think that it comes to a point where you become an adolescent, when you are trying to enter puberty. While the men are only trying to worry about their voice changes and the fact that they break it, we have to deal with the menstruation, the part where we have to bleed every month. And it's not just that alone. People would understand that it's not just when women are bleeding that they're actually going through it. We have to go through a whole circle. And most of those times our emotions are in order, honestly. Because our hormones are down. So sometimes we can get really cranky, irritable. And we just ask us that what's the problem. Sometimes we don't even know. But because our hormones are down, these are things that for some people can really escalate to a point where they will not even be able to handle it. And I know a lot of people that when they are menstruating, they don't show, they are not showing up to work because that pain alone is going to be so serious. Some people can use more than the normal parts that every other person would use. While a normal lady is struggling with 2 to 3, a lot of people can use 5, 6. Of course, there are health conditions that are predisposed to all this. And for the pain too, yes, there are some that are due to some health issues. But this is an adult challenge that mostly all women face. And some people are lucky, they don't have pain when they are menstruating. But the act of doing menstruation alone can be very tiring. The fact that you have to worry like that, sleep, and that is an entire issue. Now, one thing that a lot of people take for granted is the fact that when women enter puberty, we have to worry about our faces. You know how pimples will blow up when women are having puberty? And just very little guys have that problem. We have to worry about our body, the insecurities, when you have to get the right size of bras and all of that. Men, I feel like they don't have to deal with all of that. Now, growing up, so when the peer pressure comes in, a lot of people, of course, considering what they are now, want to try and have sex with the opposite gender. And it's the women that have to worry about mostly contraceptives. I think for guys it's just a common. Now, while trying to avoid pregnancy, a lot of women have someone with a health challenge that has to do with the fact that you get pregnant, you go to the wrong person that votes for you, it's a problem. But at that point, when you do that, you are exposing yourself to a lot of things. Some people would go and use the wrong tools, and there's infection in the womb, there's the fact that they don't even remove the baby completely, there's the fact that the emotional trauma that comes with it after the whole process is done can be an issue. Now, at that age, that same age, the infertility problem sets in. After if you get married and you don't have a child, before they point at the man, it's a long picture. The first person that shows up at the hospital and says, no problem, it's a woman, is usually the woman. Or except you have a parent and this one's problem, but the first person they normally check. Yes. I mean, that's not the right thing in the hospital, but that's what the family members would naturally suggest that, like, oh, we are well, that kind of thing, kind of my language. But you go into the hospital, of course, there are factors that will be exposed over to not getting pregnant. People have fibroid, people have polycystic ovarian disease, a lot of things that could make it difficult for a woman to get pregnant, and this is really related. From there, maybe the fact that they might have mental dysfunction, but women, We have the womb, we have the uterus, a lot of things. And another thing I should probably put in is because we have to take the pills for people who do not really use condom, post contraceptives, family planning, all of that. It makes you lose sometimes and it affects maybe getting pregnant or even getting pregnant when you don't want to be pregnant. These are issues. Now, a woman getting pregnant comes with a lot of health challenges too, because look at it this way. There are women that on a natural day they don't be stressed, but this giving birth is hectic for them. And because of some of them have issues that maybe they have hypertension in their family, like the pregnancy just escalates. There are some women that they just have hypertension when they are pregnant. That's like the thing, preeclampsia. They have to pick up with them disease. But some people have sickle cell. On the norms, the guy can have sickle cell disease and there's no problem. They can manage this well. As a woman with sickle cell and you decide to get pregnant, the fact that pregnancy alone can escalate a lot of diseases, diabetes, you have sugar level, you have to consider your child because it can affect your child's size, chances of your child's survival, all of that. So as a woman with a condition that will naturally be managed, even HIV, you have to consider three people now. The child fact that it poses a longer health challenge for them. Now you have to consider the option of okay, do you want to do that directly, or you want to open them to do that. This is a health challenge that goes on. For women that will have hypertension in pregnancy, trust me, something that could go as much as having convulsion and seizures, don't get married directly to die. Because if not well managed, it's an issue. Now, say pregnancy, you have to feed the child and all of that. A lot of women, family will not say this out, but a lot of women have to do breastfeeding. Sometimes milk won't come out from the breast. It's not every woman that gives birth without being able to breastfeed. Now that's an real challenge for a lot of women because they feel very inadequate. A lot of people come to them and say, I breastfed my baby, why is yours different? So that's when you start wondering, okay, my breast big enough. Even some that their breast is big, they have these issues. These are health challenges that women face on the lot. And some babies, because of it, simple hygiene problems, you can have your nipple retracted and also related. When I say that, that's like when you have a wound today. Children sometimes they can be very funny. From all the biting and all the all of that can actually cause an problem. And when that comes up, I'm saying that the problem with the family setting when women give birth and they say, okay, your wife don't look like she used to when she first, went into married her. The scars, all the marks from all the deaths.
The station.
And that's why we have the problem of women trying to fix themselves. They consider it a serious health challenge because when they look at themselves in the mirror, they don't feel like themselves any longer. So at that point, they want to fix it up, get their consumption, get their breast done, get their acid done. This will also predispose them to
another credit.
yes, because they get in the wrong hands and it's another story. So if the wrong person operates on your home world, it's a problem. But for them, it's something that is so important because I've seen men actually post online and write about their wives. Okay, before pregnancy, my wife was very sexy. All of a sudden, the stretch marks and these are things that will breed insecurities. Growing up as a woman again is difficult because it gets to an age where you have to enter menopause. When the menstruation is gone, but Yawa will not pass. But some people at that point, they get so angry and irritated. They get hot, their joints will start aching. I don't know if you've seen those women. There is something that every time back pain, leg pain. These are things that normally your hormones are supposed to keep you young and fresh. Men, their own hormones don't go really like that. Like they don't stop menstruating. So they still have like a level of self-regulation. That's why a man can still give birth at 90. It's maybe not be as strong, but the chances are still very likely. But when man enters on the bus and all of these extra problems that come, some of them it still gets so bad against the same. But for Nigerians, we like to struggle with now. If all of those things come, they say, requesting that back, those kind of things. So they don't see a doctor. But they actually have challenges that should be taken note of. Like you can actually go to a doctor and say, okay, I stopped menstruating, and these are things that I have feeling. But at age where you think that you should have stopped menstruating, say 14, 15, 16, and you're still seeing your menses, then you should still see a doctor. You see, these are health challenges. For people that see menstruating at that age, sometimes you're like, I'm so lucky, yeah, my body is all that. It feels so good, like, what people are not doing at that age. And of course, there are stories, miracle stories, appearance situations that will obviously happen. Maybe that one case that will be different. Or maybe you are not in one case. Because there are also conditions that will allow you to eat continuously like that. Yes. I know we jumped some of the topics and I will come back to them.
Okay.
But this is part where we talk about
Yes. Okay. So other segments of other chronic disease that women face What are they? Aside of this thing that we mentioned so far.
Oh yes. Primarily, I think for women, we have cancers. I think that I actually forgot to mention that. Thank you for bringing it up. That's the one that is blown up, and most people would have heard about. Breast cancer, cervical cancer. That one, I think that has to do with the female part. When we say breast, of course, we know where the breast is. Cervical is usually in the yes, the genital, vaginal area. That's where the cervical cancer comes from the cervix. Now, for those two, it's something that a lot of people think, oh my god, it's so dirty. Of course, it is dirty. But there are things that a lot of people are not told, and they found solutions to. They found that at some point, you can stop it. And for people who find out early, there are things that you can do about it. For people who know that, okay, their family, they have this, there are ways to screen them and prevent them.
Okay, it's inherent.
Absolutely inherent. Yes, because okay, for breastfeeding, if you say you have a mother that has it, especially for generation, actually they would invite all of the female children to be screened. There are ways to actually screen. There are now screening that you can actually do. Like two, there's some gene expert things they could do to find that if maybe you have a predisposition. So they will start giving you instructions from the beginning. Okay, when you get to a certain age, come for a checkup. If there's a need, they start saying these hormonal stresses in your blood, in your body. Exactly. In fact, I don't know if you know of the celebrity that she went as far as cutting off her own two breasts, even before she had the symptoms at all. Yes, just to make sure that she does not even have the chances of that part of her body. Because there are people that might not even have the family predisposition and they still have this status. Very likely. That kind of thing. And they will still have this condition. They still have, because what is actually happening is your genes are playing a trick. You know when you're supposed to have ADP and you have AZB in one part, apparently when it's getting scandalous and decided to turn it towards it to 2020. Then you want factors like radiation, randomness things, even our diet, the fact that we're eating Western diet now, could be a factor to have for the cancers. And for cervical, it's a little more towards the sexually transmitted infection. If you pick up the virus like human papillomavirus, which mostly is because if you want to put sexual partner or person that happens to have it, guys are so lucky in that aspect. But they will carry the weirdest diseases, especially when it comes to sexual disease, and they will not have any manifestation. Let the woman see the man with an STI, then you see discharge everywhere, maybe she's complaining. Most men when it gets really serious, we can complain of the red, maybe gets raped. But for women everywhere, they're having abdominal pain and all sorts. There used to be a thing that if a man has it, he can be 10 women. But if a woman has and she sleeps with 20 men, chances are maybe only 4 or 5 will have them. It's just the way things are. So our body is a little more, how do I say this? A little more fragile. Yes. So that way we become things a lot easier. That's why our cancers could be so specific to us. And the fact that when we have them, it is something that a lot of people can worry about. Because they can have a lot of cases of this kind of condition. The women give out and now women are this happen.
Okay, talking about the factors to be considered in determining hair challenges for women. One thing, there are some young female that they feel so shy to express themselves, like this thing, I'm experiencing this, but for them to just come to someone like, it's not even doctor, my even their parents are to discuss like, I'm feeling this, I'm feeling that, they will feel like, let me just speak, let me just speak, let me just speak. So they this self medication, how that put it, is how doing it. So what would you say in that regard?
Okay, so let's start from where you started from. I think that's like the normal number one problem that we have. If there's going to be any factor that affects any disease in this life, is what people try to keep quiet when you have problem. Everybody wants to wait till that point where they say, oh, we'll do it. Like, you know, when you go to that pit, I know that, if I enter hospital now, you are meeting. That's when you can say, I have a problem. Which is the fact that I say, not just even the men too. For women, it's more peculiar because women, if you compare your stomach now, before to mention the last case, have you seen your menses? So, not that is the first thing. You are running a pregnancy test. You cannot complain of the slightest thing. You cannot for me to this Nigeria. You cannot even try it. Just hold it like this. So these are one of the things that I feel like women For households, I feel like they pay more attention to women. They want to have more iron and they want to be stricter. So for women to really express themselves, we have a higher threshold for pain. So how a man will go through, a man will go through labor and he's telling you, hold it there, you have done it before, just try. And it just stimulates men, it just stimulates all those pain and it reduces their minds. So it just goes to show that sometimes men are used to keep things to themselves, which is absolutely wrong. So that's actually one of the factors that I think are doing. So you have to be very strong. But other things that could happen for women, we already talk about the fact that if you have something in your family, even if it's your mother's sister, please check yourself. Like you have to make sure that you do. But as much as the family has an impact in you going forward, like that's why when you want to marry somebody, of course you should ask them, what do you have in your family? So even sometimes when the mother of the husband has it, your female children, you should watch out for them. Okay, because this actually happens in your family. Let's have to ask them. So what kind of health conditions do you have? It's not just for everybody. For the female child specifically, ask them what about your aunts, what about your sisters, your cousins that are female. So you know the progression of how these things go in their family. But also we also kind of handle ourselves. A lot of people from what I found out is that they don't know that a lot of conditions can be gotten from infection. Women allergy is so important. This is a factor that will kill anybody at any point. Like at every stage of your life, you have to be clean. People will come and say they have to infection because that's like an entirely different situation. But even the pimples on the face will just be due to bacterial infection. Like being clean as a woman will protect you from so many things. Just so many. So I would advise that as a factor, we just take that out of the way. Now for sexual infection, that is something that puts us in a lot of trouble. Because a lot of women cannot go to pharmacy and say that I want to buy a condom because I had sex with somebody. They listen to the men, tell them that well maybe when we use condom, or use three of these two like this, are okay. I have seen so many people misuse. I don't know if you heard of this not before. So many ways they will tell you to use so many things, and because women are naturally trusting, they expect the men to know. They don't understand that the men don't have a special class that they go to for these things. They just hear it and they decide to pass it on to you. So we need to educate ourselves to protect ourselves. If a man is that it was very small, you have to weigh your options, make sure that it is tested. Because when you have sexually transmitted infection like woman, it doesn't just stop at infection. To go all the way, you are looking at the chance of the pelvic inflammatory disease, your pelvis will be on fire. That can cause a cyst or a mass where like the pus will be inside your stomach womb area. From that, it goes to as far as not being able to have a child ever. And at that point, it is almost irreversible. But they will have to chop a part of your fallopian tube, which is not something anybody, a part of your body anywhere. Because infections travel. It could even go as far as your blood. For men, it takes time, progression. Sometimes they might not even see symptoms like 10 years when they start realizing that they can't urinate. Yes, it could be so slow. We're not even talking about HIV now, we're just talking about the sickness, infections that anybody could pick up from anywhere, candidiasis. The minute you see discharge as a lady, smelling in the funniest way.
How about the color?
Okay, for women actually, it should be whitish, right? Maybe a little dry. It's not supposed to smell. We all know how vanilla should smell naturally. But when you have a relation from what that is, of course our body has a way, so of course we should have discharge, but not something that is now sticky or creamy. Just I don't know how to like pap. You know how pap will look like, and it will not smell. That's where you have a problem. You should actually always check it out. Me, for one, I'm an advocate of always examining your body. You have to know what's coming out of every single area of your body. They cannot ask you now that, what's your breast size, and you will not know. It is absolutely basic that you should know.
You don't even know this. So
Well,
I don't talking about ovulation period. Like they don't take notice of all these things.
That's coming to that in the profession, our community, all of that. It's just enough famous. I didn't learn it till I started growing up. So I cannot say I learned it, but when it started now, I was like, you must know what your relation is. I did everybody to that one. No, I don't. So like I don't know, maybe 4 or 5 years ago because I happened to go to my first maybe as I got lost and I started learning all of those things. But if not, I don't think I would have learned what is ovulation. Just like who knows what ovulation is. But that's besides the point. There are other factors that can affect it. The drugs that you take. If you are somebody who happens to take a lot of drugs, as a woman, it make you predisposed to the fact that it would heighten your chances of having cancer. So These are things that they will ask you. If you can actually come down with those things in them, they'll ask you that are you somebody who uses family planning, contraceptives, all of those. These are things that will naturally get. It is not a given that if you use them, you will have this condition. But there are things that could increase your chances, especially when you use them. You understand? So these are all the factors that you should be thinking about. Social factors too, like drinking, smoking, on the side. I know a lot of ladies now they want to become the trend. Men can do it. So how many bottles we go? We'll not go anywhere. We'll just maintain like this because men's body, like I keep saying, the threshold for things like that. Well, I'm not going to advise them to be other, but for women, consider the fact that if at that moment you happen to be pregnant, last son, your children could have the worst symptoms. Then some of them could even come out without the brain. That's how bad it is. There are children like that, yes. Without the basic neurological function that you should have. You don't know when and how. That's why you think advice them to do this things during pregnancy. Not just even during pregnancy. Your body is something that I assume that you should treat. It's like a twin that you are like pamper this body. You can give it juice, give it smoothie, you want to act classy, do those things. So when it's something, they don't do anything to you. There are other things to pick up. That money that you used to buy a cigarette. Buy yourself a serum, a vitamin C serum, and pamper yourself. When you come and let me ask me that why is your skin glowing? That's the truth, my dear. So these are all the factors that I think could expose you to the self challenges.
Thank you for that wonderful insight. If you are just joining us, we are on Just Event Online Women Hour, and our topic today is Women and Health Challenges. And who has been speaking with us is Dr. Rukayat Shittu of Women. So,
Shittu, yeah. Thank you.
still coming back to the phobia aspect. Talking about the phobia aspect, this even leads to some ladies relating that it affects them when relating to the whole gender. That maybe when they have something mutual relationship with, they fail to express themselves more.
Okay. I see
So
what you're doing.
this can we regard this as another health challenges for women?
I think it's a very big challenge because I think that for you to have a happy life, you have to be able to express yourself. Like, you don't just want to men, to people. I mean, you know that you insult people because of it now. You think that you're about insulting people that is expressing themselves. Be able to put your words together and say, I feel this way at this way. Now, for me, with an opposite gender, I'll just advise that whatever you feel, say it. There are men that have the habit of making you feel bad if you say something. This is going to sound a little explicit. For people who have sexual needs and desires, I don't like it this way, I like this way, I like this way. And you tell your man, and they just automatically assume that this one like this solution is straight thing. You understand? They don't understand that for women, it's not as easy for men. Men, it's usually point and kill, straight to the point and kill. But for women, it takes longer for us to reach one side, opposites. So a lot of women will have specifications as to how they want to be treated, what they want to feel like or just like. That's why there's a lot of women taking these things. You understand? So because we have been taught that if you come and tell him now that this is what you like, before men's ego is very easily hurt. No offense to all the guy questions. You understand that if you come to a man and be like, well, you can't really do it so well. The security will come in like, okay, so but this is what they say that we should all be doing. You understand? There's no class for them either. So it's really acting on the time. So you just have to keep quiet and just pretend like everything is good. But afterwards it's not right. There's a way that you can actually sit people down, men or women, and explain to them, okay, this is how I actually feel, and this is why. Knowledge is power. I feel like if you can tell them that this is that is where you heard this thing, and that is why you are saying this thing. Any reasonable person should be able to come down to your level and say, so let anybody oppress you. If they now come and say, okay, this is what you are doing is wrong, this is not how people should be, they are not anybody. This is 2021, it is okay for you to own yourself and be like, this is what I want. I heard you say something like, it's supposed to actually call upon yourself like this. I will not feel. There will be people that will not fit that category. And they will come and see you as the wondest things. But that is fine. Doesn't mean you will not find your type. You should just find someone who will understand you and the expressions, however you feel. They don't really actually have issues discussing how they feel. They need men who can encourage you. So I feel like the men should let it come to you, ask women, okay, so how are you feeling? So what do you like? Okay, so how going forward, what would you like? And for women who want to say no to situations like that, I understand that because the world now everybody is saying do something, you want to do it too. It's a lie, everybody has in mind. If you know that in your heart of heart and spirit of spirit, you're not ready to Just please tell them that no, it's okay. Don't let anybody tell you, yeah, I don't believe it. In this 2021, you're not doing what everybody's doing. It's like you find the man that will love you for not doing those things that most people will indulge in. And if you do, that's also fine. Just go on your lane, stay with your truth, and make sure that whatever you do, you are happy with yourself. Like you can put yourself and say, I made that decision. Regret or no regret, will bear the consequences. Before me, I will write it. Whatever part you do, just stay with it. Stay.
Thank you for that. The number four questions, okay, how to improve access to care and effective treatment for women.
Okay. So before I dabble into that, I just want to mention like a few things I think that we should actually talk about. How to improve it actually falls under the same category as management and prevention. So I will just say that as a woman, to start with, whatever your love challenges, you should be able to communicate. One, let's share that one. Two, you should be able to listen. No one will feel that there's one stable sector in being a woman that works. I don't know if you've heard of those guys who after they did their series, I would go and carry them into organization. I didn't have no okay, so apparently when you go there, there's this women that will sing songs to you, or explain things to you, it's songs and happiness, feel that sweet, they tell you what your language. Everybody's always doing that to you. But that's the sector that works. And you know why people will never get that in addition, especially if there's somebody that is zero and number one, it's close to cheap, you don't pay anything.
Yes.
And number two, you have people of like minds. You have a support system around people who will listen. You're going through the same thing together. But when you come on, it's the same condition. So when the person that is talking to you says something, you cannot relate to it. You understand? Three, there's a professional and a mother or a father who understands what you are going through. Of course, I have female or male nurses and non-female doctors. So they understand, they've had experience on what they've seen previously. So they have time to explain them in the language that they understand. You see, if you are talking to people that are not literate, especially in English, of course, and you are speaking English, then they are going to achieve nothing. That's why when you go for organization, they speak all languages. You don't see them forming accents, anything. They tell you straightforward. I want to draw money. The songs you will even sing will be in your language. It will be sweet. Everything will be melodious. So I feel like to make sure that things get better, you have to provide an atmosphere where women will want to come in and have that conversation. Growing up, if from when they give that teacher, they're already telling them that, it might become good around money, that kind of thing. Like, don't let them, this is disadvantage. People are ready from parents, they are prepared, they can tell their husband. If that wants to happen, they can bring them to the hospital, they will educate them. Now, further actions, if they decide to go for, of course, there are legal actions that will take that. That is in extreme cases. Growing up, it's not the one that your parents go and say, I don't see this man, if you don't see you're pregnant, you really have menses. So somebody is there, they can take you to a doctor or a counseling session or health talks for people of SS1, SS2. During my own time, it was, I think, always that came to our school, come and tell us, they came to your own. Even if our teachers added extras, that was not necessary. But these are little things that people overlook. I don't think youth of nowadays actually have the opportunities to get, but it really taught us a lot of things. They put liquid on the pad, so how it was, they wore it. It was sweet. I mean, there was a lot of video that really frustrating, but a lot of people paid attention and they learned. And one thing they find about it, as much as babies are closed up and they say, hey, I don't do this, I don't do that, they are listening. All these small children, they are listening to you. So it's better you sit them down if you feel like you're not in a position to educate them properly. Organize something, call a doctor. An advisor, even if the government has the capacity, these things will cost less to nothing. Just to get a professional. Maybe once a week, should run around schools in every local government and talk to it. You don't have to pay for food or anything, you just pay professionals to go around, talk to you, just educate them, find out how they're doing. They just have interpersonal relationships. This is sweet, this is nice for them. These are ways that you can actually improve it. Now, getting pregnant fans. This is part where you have to enter the streets like a property man and talk to each and every one. When people are getting married, sit them down and counsel them. I understand that. Some religions actually have provisions for it. Like for us, I think it's happened. I think it's Italian. This is actually have a camp, like a great wedding camp for it. I think we should incorporate it. It's not just, I feel like the religious people saying that.
Yeah, no one is in that.
Yeah, but I feel like it should not just even be the religious people, it just carry them out. As much as I've been wonderful one, couples should invite adults or going to the hospital to 2 3 months before wedding, please, I'm about to get married. Let the doctor run you through every single thing that you need to do. Make a checklist, tick it off. Is my wife clean? Is my husband clean? What's our agenda? It's only that many times already there, so you don't have access. There are other things that you can have. So I have a family condition, for abortion, blood pressure. In our family, when people are pregnant, their blood pressure is high. Left out. My mother has this condition. These are things that can happen. How can we make sure that both of us don't have it? Is there any vaccine? Because things like cervical cancer actually have vaccines. They're just really expensive at the moment. It's like maybe 50, 10,000 or 50. I don't know. It depends on what discounted price is being offered. Breastfeed, do your screening for your wife as an act of love. Go to the hospital at that age. If basic things like ultrasound should be done, look at her food now. Is it in good condition? Is there an infection? Is there something you should manage? Is there fibroid? And going forward, how do you want to manage it? Once she's pregnant, see the doctor. So afterwards, it has a hospital.
I think the husband should be supportive in this regard.
This thing we are talking about is not just for women.
Mm.
If the men are not 100% on ground, we are deceiving ourselves. But if you educate a million women, and at the end of the day, they go back and tell their husband this, this, and that, and it's apparent. When you tell your uncle, your brother, your cousin, and it doesn't sound like something that you used to, you almost see that as an attack. But this is not what I was doing. You understand? So they have to be on board with you. You have to educate the male child to educate the female child. Because at the end of the day, the man is not the
How to educate the male child to educate the female
yeah,
child.
so because the father will be the one saying, okay, oh yeah, let's go forward with this thing. They have to get permission after that. Because it's still a joint decision, but it's two-sided. We cannot just carry it out now and say, we're going to just keep for this that. For the family looking at it, share money family, you understand? So things have to go in order. The man has to be actually involved. I have to give it. That's why I've actually figured out that when you're doing all these talks, why not involve the men? I mean, I feel doing our own part. They did not put the men, they're just defeating the class today. But subsequently, all the health outreaches as well, we actually never separated the sex. Let them be there. Let them be. They'll have sisters, they'll have wives, they'll have daughters. So why shouldn't they know how to use the pad? I let them see too. So when they have girlfriends going forward, they will not misinform them. You understand? These are actually things that I think is very important. So when you want to do something related to ladies, don't remove the guys. So they will not feel like maybe we are holding this also. It's something everybody should do. That's why when I'm menstruating, you don't see me hiding it. So she there's something paying you. See, I'm on my menses. It's not like something you all do it and simple. Somebody's going to steal it from them. You understand? So yeah, that's all.
So in recap, we're about to do the content of today's segment of just a minute online women are. Glad to have you here today, Dr. Shittu.
She's so my pleasure.
So, a recap of it, your advice for the society, for the government.
Government, I'm just going to say that the doctors need more hands. We could use as much help as we can. Our health education is lacking. People are ready to enter the street for little or no amount in charity and in service to educate these children, women. We are ready. I think anybody as a doctor will be ready to go into the streets. The thing is, most people don't pay attention to preventativeness. If you can tell them before they have these conditions, a lot of sickness and hospital admissions will be avoided. If a woman knows that this is how you manage the child, you don't have to have children admission as much as we have it. If a woman knows that, okay, if I can even get pregnant, well, let me use my pill, people will not be aborting babies and dying. You understand? So I'll just advise the government to please involve doctors and invest more in young cares and maybe plan more outreach in communities so that we can get out there and actually see what's going on. Surveys, that's basically just outreaches. And to whatever that person, play your part, support your loved ones, love your women, treat them like queens, adore them, not be lazy today, tell them they're strong because every day is a new challenge for a woman. And she's like this now, my challenge is oh God.
That's the challenge.
It's a challenge.
Everybody's challenge, not even only women. Women.
Yes, okay, fine. Let's challenge for all the
Everybody.
women. Yeah,
Everybody.
Well, thank you.
So my own personal question to you, who is Dr. Shittu? Who is Dr. Shittu? We try to have a citation with them. So we want to know who is Dr. Shittu.
Okay, so I'm not going to report myself. Apparently, she really tried to get some. Well, I'm not going to say. Basically, I'm a medical doctor. I am a employee personality. I actually do have a show of my own. Of course, Doctor's Lounge. And of course, I have a blog actually, there and that's not short. I'll be talk about every health issues every single day of life. So prevention will not get on the streets. People can still check pages and still see what's going on. Like what she's saying here. She just wants to make sure that you get that on point. So yes, that's the best way to do it. And every day I'm just a happy person. I try to be a good person. I know it's really hard. A lot of people are struggling. And I think that at the end of the day, just giving an act of kindness or telling yourself today I choose to be somebody good and somebody awesome and somebody that will lend and help out to others is enough as a human being, irrespective of your education. And if you feel
Something just popping like a question. There is this family. I think there are some family that you know a child saying this will surely imbibe what the mother is doing. I think we need to advise our mothers
mothers
and their upcoming mothers and the already mothers.
the thing is, I know it's hard to be a mother. Let's all admit that to raise another child apart from yourself is really difficult. A lot of people don't understand how hard it is. But as much as it is hard, hospital bills are harder. Children are very strange people. From just vomiting at stool, in 2, 3, 4, 5 days, you will lose a child. I'm telling you, the one that will like this, you can go through this like that, zero feelings to carry. Children don't have the last that. You have to make sure that you take care of your child. Don't let societal pressure tell you that this child like this 2 months, give the child pap now. You don't know what kind of water is in the pap. Forget your environment. I mean that is so important. The water that you drink as a mother. How you preserve the child's items, the clothing, the cups, what you used to feed your child, the kind of water you used to feed your child. Because you will not even be able to explain it when your child starts listening to you. And so just please be careful. Don't listen to other people, except your doctor. I hate to be that person. But I understand that women, generation to generation, want to pass out a lot of advice. Even as little as using hot water inside pillow to press your child's breast. You suddenly notice that that place starts swelling and then you come to just to panicking. How can a new child be having breasts? Very little things. I just feel like women take care of yourself, take care of the child. Do not do what your doctor tells you not to do. See all these vitamins you want to give your child because are extra health at 3 months. Don't do it. Your breast milk is sufficient. Like don't even touch it. Just feed your child as you have been advised. 6 months exclusively. Take care of the environment. Look good. If you feel tired, as a mother, find an alternative. Me, I'm a strong supporter of getting help. You're not sharing mark where you maybe like taking a little child for 24 hours like getting kind of like this baby with your child. Have a plan that works for you. There are career women now. Just make sure that the child gets an appropriate milk and time, not make us small forms, really healthy. Or be healthy to as mother. If you are sad and you're angry, your child will not be happy. I can tell you, you have a very irritable child. You have to be able to smile. That is what you're used to feeling. So at the time when you feel like I need to take a break, you your husband. Have a sister, support system, someone who can take over for you. At the time when you need to. But in happy, I mean, I'm happy you can remember that I'm not really need to. So take care of your mental health first. And take care of yourself. And just remember, you are a priority. And then you can take care of the child. Just be content. Don't let anybody tell you you're bad as a mother. You're doing amazing. Try to learn, update your knowledge. Tell yourself that I can do this. There is no one out to raise a child. You're awesome. Whatever you want. You have a child, you're cool.
And what are the two breastfeeding? Instead of them, like they will still together, like giving penetration. But sometimes you still keep where it might even be wrong.
Yes, so I'm telling you.
But if you to accept that,
and I think it is important. Give me over my you don't know you are always on time. But I feel like I can take anything you put. That there was no match. What I'm hearing about take it out. Like one breast is apparently supposed to be like that, but you need to have it in rash, then there's no way, or maybe we get it together that you should. We are pressing that it's painful, or you are feeling something that is okay. Our head is also disease. Yes. I'm going to tell you if you feel like something is not right. Better check it out. But as much as some people might actually feel that way, I'm not seeing it like this. So if you are telling yourself that I don't think this is right, of course, that's appointments in public hospitals for us to let us understand that. Don't go out to what you're saying. If you're not getting to like this, things are fine. I can take it into the rest. But that breast milk discharge is a serious problem. You should go to the hospital. Don't let anybody tell you that you should not do. Don't go and use PCM. or any problem, and then people now feel that I'll come back to the table of fight, and now become so many problems. And find the permanent solutions to your problem. Do not just treat it as you want. What's the age? We are nice people, and I mean, people think what I mean, like, we try that you should come and meet us, let's take care of you. That's what I do now, to be taking care of people.
who have been speaking, giving us better education about women's health challenges is Dr. Shittu for your across our lives that women's health matters to ourselves, our family, and the society. Join us for another edition of Just Women Over Women, our next week. I'm still your host, Rukayat Shittu. You have a wonderful rest of the day.
Bye. Ah, thank you for having me. I will let that go.